From Limpopo to Toronto in Canada and back in South Africa with a Global Award. That's Dr Lebogang Phahladira, a specialist psychiatrist and senior lecturer at the Stellenbosch University. He has bagged the Global Schizophrenia Award conferred by the Schizophrenia International Research Society. While in the final stages of completing his studies, Phahladira moved from gynecology to specialize in psychiatry. And he says mental health and the brain are fascinating and something that prompts continuous research. Now, Dr. Phahladira is with us tonight. He joins us virtually from Cape Town, and we thank him for his time this evening. And congratulations on this fantastic award. And I'm sure, Dr. Phahladira, you would be the first to say that when you received that award so far away, you couldn't help but think about young Lebogang, who grew up somewhere near Modemole here in South Africa, but then also about all the work that Dr. Lebogang still has lying ahead for him. Just your reaction to being recognized by this global body.
Thank you very much for having me, and good evening to the viewers at home. Yes, it's indeed a humbling moment to be recognized on a global scale for the work we've been doing in South Africa and in Stellenbosch University. And I think it's not only a recognition for me or to me as a person, but also it goes to the rest of the team at Stellenbosch University. But I think, you know, I said to some people that it also, you know, serves to hopefully motivate many young people in the continent who I know are in many ways better than me, to keep trying in whatever field, to persist, and you know, one day, you know, that day will come.
You were quoted saying after receiving the award, and you received the award along with your colleague from Rio de Janeiro in Brazil, a joint winner, and you commented that it's easy to do research in developed countries, but in Africa we work in resource-constrained settings with competing priorities where mental health is low down on the list in terms of funding and other opportunities. And I'm sure you, along with your colleagues, still really believe that the work that you're doing is a calling right now in a country faced with so many challenges like we are here in South Africa.
Absolutely. I think, you know, there is, you know, you know, what has been encouraging is that, you know, the research we've been doing for the past 10 years, you know, competes on a scientific level with people who have millions and millions of dollars into research, whereas on our continent, as I said, you know, we have competing needs, rightfully so, and you know, often research, you know, is not a priority, but particularly research in mental health is not, you know, appealing, you know, to funders and many other, you know, decision makers. So I think for us, with the limited resources we have, from, you know, a country, you know, with many challenges like South Africa, but you know, on a positive light, you know, from a university which I think is growing to be one of the top universities in the country, it's been a very humbling moment.
Now, we said there in our introduction that you decided a little while ago, or not so little while ago, years ago, to switch your speciality from gynecology to psychiatry. Talk to us about what made you decide that this is where you want to spend your life's work.
I think, you know, psychiatry was my lowest mark in my final year at medical school, where,
wow,
you know, I did very well in gynecology and general surgery, and I thought maybe I would become a gynecologist, but I think, you know, during internship, community service, interacting, you know, in Limpopo with people with mental illness, very, very, very difficult circumstances, I think the love for the field grew, and that is when I decided to go specialize at the University of Cape Town in psychiatry, and I took a career in research when I joined Stellenbosch University 10 years ago. And as you said, this is only the beginning. We have a lot of work to do, and I hope that you know, many other people will take keen interest in you know, the burden of mental illness, particularly for the most vulnerable on the continent.
Now, just from reading up on you, you matriculated at the age of 16, so already there was something special, special about you. But you also grew up with your grandparents. You were born into apartheid South Africa, like many of us were. Spent most of that growing up with your grandparents because your parents lived in Johannesburg and wanted to shield you to a certain extent. But you know, you faced adversity of some kind. You speak about how you had to study for matric with no electricity. So there were those challenges that you faced growing up. How do you think that prepared you for what you were to face? Because just today, I received a joint press statement from the Children's Institute at the University of Cape Town in conjunction with the South African Association of Child and Adolescent Psychiatry and Allied Professions and a number of other organizations, talking about the high levels of adversity which increase children's risk of developing mental health problems. And I wonder how you grow up in that specific age in South Africa's history prepared for you to face certain cases, specifically, as you say, for our most vulnerable, where especially our children face so many different kinds of challenges on a daily basis here in South Africa.
I think it is, poverty on its own, does not, lead to poorer outcome, if you can put it that way. I think, I think the football coach who says, adversity is often a breakfast of champions. I come from humble beginnings, but, I was reared by my grandparents with very little, but I was loved, I was taught, respect, but at a very young age to persevere and, that nothing comes easy. You got to put the work, you got to be patient with yourself, you're going to make mistakes, you're going to fall, but giving up is not option. You got to persist. And, if you're going to go into a career and research, things take time. There is no easy gains. You got to put in the work, you got to be patient. And that is what we have done in the next 10 years. And we're hoping that, in the next 10 years, we'll take the research, particularly into schizophrenia as we move into different challenges to another level.
And like you said, you had the support base, and of course the support base that so many other children or young people in South Africa don't have, specifically when it comes to mental health issues. And your field of expertise specifically looks at long-term treatment outcomes. How important is it for early diagnosis for mental health issues, specifically for children and young people, when it comes to getting a more positive outcome for how that person then grows up and into an adult and hopefully to live with more positively with the mental health issues that he or she has?
It is very, very important. So our next level of research will be looking at exactly some of those factors. How, particularly environmental factors, childhood adversity, the level of violence, conditions, such as malnutrition, affect, brain development and how that relates to, the disease I have interest in terms of that is schizophrenia, and how those, affect treatment response and long-term outcome in many people that will be treating. So there is no doubt that, environmental factors, where you're growing up, trauma, cultural differences play a role in, the risk for mental disorders like schizophrenia, like depression, and bipolar disorder. So that is our next phase of what we need to look at in the next 10 to 20 years. In the continent such as ours, with many challenges that we're facing.
Is there a concern from you that mental health issues like schizophrenia is going untreated and undiagnosed in these under-resourced areas?
I think my concern is greater than that. I think on our continent, particularly in South Africa, non-communicable diseases are not getting priority. So that is, mental health disorders, cardiovascular diseases like hypertension, obesity, hypertension. Those are not getting, priority, such as, communicable diseases, such, like HIV, for example, or COVID-19. So, and those are, I think, diseases, non-communicable diseases, for example, like cancer, have overtaken, communicable diseases in terms of the burden on the health system, but in terms of outcomes such as severe morbidity and mortality. And I think the time has come for all of us in South Africa to reprioritize, our resources and our efforts in addressing what we are facing today. I was saying that, if we are to fix, healthcare in South Africa, we need to do 5 things. We need to agree on a plan. We need correct people in leadership taking correct positions, including leading public hospitals. We need to decentralize care and treat people closer to where they live and get rid of ivory towers such as bigger hospitals. We need to promote primary health care, move from treating to disease prevention and early detection. But also I think, the last point is that for me, in 2023, non-communicable diseases are a priority and deserve a fair share on the table.
Well, all I can say is amen to that list, and hopefully in our lifetime. Dr. Lebogang Phahladira, it's been a real honor chatting to you and getting to pick your brain even just for a few minutes. We wish you everything of the best for all of the work that lays ahead to you and your team. He's the specialist psychiatrist and the member of the Department of Psychiatry at Stellenbosch University, where he's a senior lecturer and specialist psychiatrist. We thank him for his time.